Imagine a small finger-like pouch in your abdomen that you probably never think about until it becomes inflamed and threatens life. That is the appendix. Now, when it gets blocked and inflamed, it can turn into a ticking time bomb. This condition, known as appendicitis, is one of the most surgical emergency worldwide. Knowing how it starts, the warning sign, and what happens if it ruptures can make the difference between quick recovery and life-threatening complications. Hi everyone, I am Beatrice. In this video, we'll look at appendicitis. We'll look at the causes, the slash pathophysiology, the signs and symptoms, how to diagnose it, and how to manage it. Now, before the end of this video, we'll look at some NCLEX-Style questions that will test your knowledge on this topic. So if you are ready for today's lecture, let's begin. Appendicitis simply means inflammation of the appendix. So what is appendix? Appendix is a small finger-like pouch, like a small organ, just like a finger, that terminates at the end of the cecum. Cecum is the beginning part of the large intestine. So when you look at the large intestine, we have the cecum, we have the ascending colon, we have the transverse colon, the descending colon, the sigmoid colon, and the rectum, and finally the anal canal. So just at the beginning of that cecum, which is located in the right lower quadrant of the abdomen, that's where you have this appendix attached. Now, is there any role of this appendix? This has been debated over the years. Now, before now, people believe that appendix is just a vestigial organ, just an organ that is there, but it's not playing any role. But over time, with research, it was discovered that appendix actually play a role. It play a role in immune function. It also play a role as a safe house for good bacteria or gut bacteria, or some of those microorganisms that help in digestion of food. So let's say somebody have infection like gastroenteritis, where there's diarrhea, the person is stooling, the body has a way of not clearing off those bacteria. So some of those bacteria that are needed or helpful in digestion will hide inside that appendix, so that after that episode of diarrhea is gone, those bacteria can resume their function again. Now let's look at the causes of appendicitis. Now the number one cause is fecality. That is Harding stool. So that can block the lumen. The appendix itself is very small. So imagine when there is compacted stool there. So it can block that appendix. Another one is infection, like viral infection. It can lead to the lymph nodes around the appendix being inflamed, and that can cause obstruction. Another cause is foreign body. From anywhere it gets into the appendix, it can block it. And then another one is intestinal parasite, those worms, it can block the appendix. And finally, in some cases, there could be tumor that can also lead to the blockage of the appendix. Now let's look at the pathophysiology of appendicitis. So first of all, we know that it's going to begin with obstruction or blockage of the appendix. So when that happens, there will be increase in intraluminal pressure. So inside the lumen of the appendix, because it's so small, and imagine the blockage now, there are mucus that are secreted inside the appendix that cannot exit. There are bacteria there that cannot exit. There are other things that are there that can be fluid, things that cannot exit the appendix, that will cause so much pressure there, and that will lead to also venous congestion. So the blood supply becomes obstructed, especially venous return. And with time too, the arteries also becomes obstructed. They are not able to properly supply blood to the appendix. That can result to ischemia. And while that is going on, there's also bacterial overgrowth, because those bacteria are not able to exit. And then with all those things happening, and also with the decreased blood supply and the ischemia, the appendix wall can begin to suffer death, necrosis, and that can lead to rupture. And with rupture, we know what can happen: peritonitis, abscess formation, shock, death. So this is how the pathophysiology of appendix can result to all those problems. Let's look at the signs and symptoms of appendicitis. The number one hallmark sign of appendicitis is right lower quadrant pain. So it will be localized around the McBurney's point. This McBurney's point, to locate it, if you put an imaginary line from the umbilicus to the right anterior superior iliac spine, if you draw that imaginary line, 2/3 to the umbilicus or 1/3 to the right anterior superior iliac spine, that's where the McBurney's point. For the pain, it's going to begin first at the periumbilical region. but with time it's going to localize at that McBurney's point. And that makes sense because if you look at the anatomy of where the appendix is located, it's located at the right lower quadrant, just attached to the sickle. So if to help you remember, when you look at somebody, just picture their right lower quadrant, picture where that siccum is located. That is where the pain will be localized later on if the patient have appendicitis. The next sign and symptoms is rebound tenderness. So this one has to do with a pain that the patient will feel when you palpate that region, that McBurney's point, and suddenly release your hand. The next signs and symptoms is anorexia, nausea, vomiting, and then there will be increased white blood cell, and that makes sense because of that overgrown bacteria and those microorganisms. And then, of course, with that, there will be fever, and then bloating, abdominal distension can be seen, especially in children. And then, patient can at times experience either constipation or diarrhea. Let's look at the diagnosis of appendicitis. The first one is history and physical examination. You ask questions. You are going to also do some physical examination. You look at the patient properly, you look at the abdomen, you will do some palpation. First, you palpate generally, and then you try to localize it to that McBurney's point. So most of what the examiner do, first of all, you press deeply, like you palpate deeply, and suddenly release your hand. You're going to see the patient will even hold your hand. The patient will shout for pain. So that's a sign that appendicitis could be going on, when the patient will feel that strong pain at that right lower quadrant around the abdomen. And then imaging, the most accurate is CT abdomen, especially in adults. They can also do ultrasound scan. This one is more, they use it more, especially for children. Then complications. Some complications that can arise from appendicitis include perforation or, we say, rupture of the appendix. So when the appendix becomes ischemic and necrotic, it can lead to rupture. So when a rupture is a big problem, and they can lead to peritonitis, those content, those pores, mucus, those bacteria and microorganisms that are stuck in there, even the blood that is maybe stuck in, stagnant and clotted, they can empty all their content to the peritoneum. We know that peritoneum ought to be a sterile space. So we know that peritoneum itself is a lining, that something that lines the abdominal cavity. It's supposed to be sterile. But when those content empty into it, that's serious infection. Now, one of the signs and symptoms of peritonitis that you need to know, especially as a student, is bud-like abdomen. So the abdomen, when you palpate it, it's as if you are touching the body. It becomes so rigid, so hard. And also it becomes so tender also with pain, and there's this rebound tenderness that the patient will also feel. Other signs and symptoms include tachycardia, increased heart rate, increased respiratory rate. The patients will feel nausea, vomiting, and you see the abdomen also looking so distended with fever. The temperature will just increase suddenly. It could be a sign that infection is going on, peritonitis is going on. Then abscess formation, at times there can be pus collection in the abdomen because of that ruptured appendix, and all those appendix dump their content there, can form like a pocket of pus. And then sepsis can also happen. This one is a serious one, a severe infection. Then we'll look at the management nursing intervention for appendicitis. So now for the treatment of appendicitis, it is surgical removal of the appendix, which is appendectomy. It can be done in two ways. The laparoscopic appendectomy is preferable, is less invasive. The surgeon will make incision, and with a laparoscope and a camera, they're able to visualize and cut off the appendix. But this one may have limitation if the patient have like pus, abscess, formation, or there are some, if peritonitis has happened and so there's fluid collection, infection going on, they may have to do the open appendectomy. Now let's compare the pre-op and post-op care for a patient that have appendicitis. Of course, as a nurse, when a patient have appendicitis, you know that the patient is going to go for surgery, appendectomy. What will you be doing? You put the patient on nothing by mouth. There will be an order for that. There will be prescription to put the patient on nothing by mouth. The patient will be on IV fluids. And then you are going to be assessing and monitoring their pain. You need to monitor the level of pain, because if the patient suddenly tells you, oh, I think I feel better, no more pain, I don't feel any pain, and the patient has not gone for any surgical intervention, they've not removed the appendix, all of a sudden the patient doesn't feel pain, that's a red flag, a red sign that maybe the appendix must have ruptured. So you want to monitor it closely. You will also be administering prescribed pain medication, but most times they don't want us to give too many pain medication because we don't want it to mask the sign of rupture of appendix. So because of that, when the patient we are giving pain medication, we are monitoring the pain level, We're also going to be applying some non-pharmacological approach for pain management, like proper position. You can get the patient to adopt a fetal position where they flex their knee, coil towards the way the fetus coil in the womb, just to relieve that pressure around the appendix that is inflamed. And then something very important, in fact I put no here with red. It's very important while the patient is awaiting surgery. Do not administer any laxative, do not apply any heating pad around the area, or do not give any enema. Any of this can lead to rupture of appendix, so we don't want that risk at all. So we say no heat application, no enema administration, no laxative. Now for the post-op care, when the patient is done with the surgery, you monitor the vital sign closely, you also monitor the pain. You will encourage the patient to cough and deep breathe, so those cough and deep breathe exercises to help expand the lungs, to keep those alveoli inflated and working properly, and to prevent the risk of pneumonia. You also encourage early ambulation. That's also to also prevent pneumonia, clot formation, deep vein thrombosis, normally for any patient that undergoes surgery. And then another reason why we encourage early ambulation for a patient that have just had appendectomy, especially if it is done laparoscopically, is to encourage or to facilitate the removal of that gas, the CO2. Because when they do it with that laparoscopic method, the surgeon is going to pump in the CO2 gas into the abdomen to help push some of the organs, some of those intestines aside, so that they can properly see, to be able to remove the appendix. And when the patient is done with the surgery, the patient may complain of some referred pain to the shoulders, and that's because of that gas that was pumped in during the process of surgery. So you need to teach the patient about this, that shoulder pain is normal. Then another thing, you need to monitor the surgical site, check the site to ensure that it's healing properly, no infection. And at times, if the patient had peritonitis or there are pus there, they may put some surgical drain to drain out some of those things. If they do that, so you have to monitor the drain. Take note of every amount of the drain that is put out, because once there's no longer drain that is coming out, that's a sign that those things are cleared off from the peritoneum, from the abdomen. That's a sign that the patient is recovering, and it's also a sign that they will remove that surgical drain. So you monitor that. And also, to facilitate that draining, you can put the patient on their right side, to help collect those fluids and drain it properly. Another thing is, we monitor bowel sound. A patient that just had appendectomy, their intestine has been worked on. We don't want the patient to start eating suddenly, we want the bowel sound to return. We're also monitoring, asking the patient, have you passed flitters, any bowel movement? So you monitor those things very well. You are going to be auscultating the abdomen until you see that gurgling sound return. Then you administer pain medication. At times they put the patient on antibiotics, especially if there's infection already going on. And finally, nutrition. This should be gradual. You start from clear liquid to full liquid before you progress to solid. And the food should be very high in fiber, because we don't want the patient to strain after appendectomy. We tell them to splint the side. Let's say they are coughing, teach them to splint the side, so that to prevent wound dehiscence, where the wound will rupture around the abdomen, because they will feel that pain when they are trying to cut them to try to splint the side. So now let's look at some NCLEX-Style questions that will test your knowledge on appendicitis. Question 1. A client with suspected appendicitis is most likely to report which of the following symptoms? A. Left upper quadrant abdominal pain relieved by eating. B. Peri-umbilical pain shifting to the right lower quadrant, nausea and anorexia. C. Severe epigastric pain radiating to the back relieved by sitting forward. D. Lower back pain with urinary frequency. The best answer will be B. Peri-umbilical pain. So this pain will localize later at the right lower quadrant, that's the McBurney's point. And the patient will also feel some of those things like nausea, loss of appetite, vomiting. These are classic signs of appendicitis. Question 2. A client with appendicitis suddenly reports that their severe abdominal pain has subsided without treatment. Which is the nurse priority action? A. Reassure the client that the condition is improving. B. Document the findings and continue to observe. C. Notify the healthcare provider immediately. D. Offer clear fluids and advanced diet as tolerated. The best answer is C. Notify the healthcare provider immediately. Why? The reason is because This is a sign, it's a warning sign that maybe the appendix are ruptured, and we don't want that at all. That's a surgical emergency, so you need to report it immediately. Question 3. Which assessment finding in a client with suspected appendicitis would indicate peritonitis? A. Soft non-tender abdomen. B. Abdominal rigidity and rebound tenderness. C. Pain relieved by lying on the left side. D. Bowel sound present and hyperactive. The best answer will be B. Abdominal rigidity and rebound tenderness. So peritonitis is characterized by this bud-like rigidity, severe abdominal pain and rebound tenderness. Question 4. A nurse is preparing a client with acute appendicitis for surgery. Which preoperative intervention is contraindicated? A. Keeping the client NPO. B. Applying a heating pad to the abdomen for comfort. C. Starting IV fluids. D. Administering IV antibiotics as ordered. The best answer will be B. Applying a heating pad to the abdomen for comfort, because this puts the patient at risk for rupture of the appendix. Question 5. Following a laparoscopic appendectomy, which nursing intervention is the priority? A. Encourage early ambulation to reduce gas pain. B. Keep the client NPO for 7 days. C. Apply heat to incision site for pain relief. D. Remove the surgical dressing within 12 hours. The best answer is A. Early ambulation. The essence is to help absorb that CO2 gas, to push it up to be exhaled, and that will reduce that first shoulder pain that the patient will feel. And also it also prevents some complication. Early ambulation prevents complications like pneumonia, deep vein thrombosis, any form of blood clots. So that wraps up today's lecture on appendicitis. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.